the 2-minute leg test that predicts how long you'll stay independent. A few years ago, researchers followed more than 1,700 adults for over a decade to answer one question. Could a single 10-second test predict how long someone would live? They asked each person to stand on one leg, unassisted, for 10 seconds. Nothing more complicated than that. When the results came back, the numbers were hard to ignore. The people who could not hold that position for the full 10 seconds had an 84% higher risk of dying within the following years compared with those who could. Not a small statistical blip. 84%. And here is the detail that should stop you cold. Among adults in their early 70s, fewer than half could pass it. If you have not tried it recently, try it right now, carefully, with a chair or counter nearby in case you need it. Lift 1 foot an inch off the ground and count. Whatever number you land on tells you more about your legs and quite possibly your future than almost anything else you could measure at home today. This video is going to explain exactly why that test matters, what is actually failing inside your legs when the numbers go against you, and 5 research-backed movements that retrain the system before it becomes a bigger problem than cold feet and swollen ankles. None of this requires a gym membership, special equipment, or a dramatic change to your day. What it requires is understanding one muscle most people never think about, and training it the specific way research shows actually works. The signal, not the disease. Here is a number worth sitting with. By the age of 70, close to 1 in 5 adults has some degree of peripheral artery disease, a narrowing of the arteries that feed blood to the legs. Most of them do not know it yet. It rarely announces itself with a dramatic symptom. Instead, it shows up as the things people over 60 have learned to treat as background noise. Cold feet at night, ankles that swell by dinner time, a dull ache in the calves after standing too long, or that unsteady lurch when you stand up too fast. Every one of those is a signal, not a random inconvenience of aging, and the signal almost always traces back to a single mechanism most people have never been taught about. Blood does not simply flow back up out of your legs on its own. Gravity is working against it every second of the day. The system that actually moves it back toward your heart is your calf muscle, and physiologists have a specific name for what it does. The skeletal muscle pump, sometimes called the peripheral heart because of how much of the workload it carries. Every time your calf contracts, it squeezes the deep veins buried inside your lower leg, and that squeeze forces blood upward. One-way valves inside those veins snap shut behind it so the blood cannot slide back down before the next contraction. Researchers estimate that this pump handles a substantial share of the work of returning blood from your legs to your heart, work your actual heart cannot do well on its own from that distance against gravity. The problem is that this pump weakens with age in 3 specific ways that compound each other. Vein walls lose elasticity and stretch out. The one-way valves inside them begin to leak, allowing blood to slip backward. And the calf muscle itself shrinks through a process called sarcopenia, the same age-related muscle loss that affects strength and mobility throughout the body. Add long hours of sitting, which switches the pump off almost entirely, and the result is blood stalling at the ankles instead of climbing back up. Swelling increases. Oxygen delivery to the skin drops. Feet run cold. And a 2025 systematic review in the Journal of Orthopedic Surgery and Research, which pooled data from 16 separate randomized controlled trials, confirmed something that should reframe how you think about fixing this. Simple, targeted calf activation measurably improved venous return and reduced lower leg swelling in older adults, independent of how much walking they did. There is a second layer to this that rarely gets explained. The veins in your legs are considered a capacitance system, meaning they can hold a disproportionate amount of your total blood volume at any given moment, sometimes described as holding up to 2/3 of the body's blood when a person is standing still. That is precisely why prolonged sitting or standing without muscle activation causes such a noticeable drop in circulation quality. The moment the calf stops contracting regularly, gravity wins by default, and blood accumulates in exactly the vessels closest to your ankles and feet. It also explains why the swelling so often gets worse, specifically in the evening, after a full day of sitting has given gravity hours of uninterrupted advantage. That last part is the piece almost nobody explains clearly, and it is the entire foundation of what comes next. Why the advice you have already been given isn't fixing it. If you have already been told to walk more, elevate your legs and wear compression socks, you are not getting bad advice. You are getting incomplete advice. Each of those does something real. Compression socks apply external pressure that helps prevent blood from pooling. Elevating your legs uses gravity to assist drainage temporarily. Walking, in general, is one of the best things you can do for cardiovascular health at any age. But none of these 3 things restart a weakened calf pump the way a targeted, sustained contraction does. and that gap explains why so many people follow all of that advice faithfully and still deal with cold feet and ballooning ankles by evening. Walking is a series of brief, glancing contractions. Your calf tightens for a fraction of a second with each step, then releases as your weight shifts forward onto the other foot. It is enough to matter, but it is a shallow squeeze compared to what the pump is capable of when a contraction is held. Geriatric researchers track a related measurement called gait speed, quite literally how fast a person walks, and refer to it informally as the sixth vital sign, ranked alongside blood pressure and pulse in terms of what it predicts. A decline in gait speed is one of the earliest measurable signs that strength, balance, and circulation are all beginning to erode together. That is useful information, but it is a symptom tracker, not a treatment. You do not fix a weakening pump by walking around it. You fix it by training the specific contraction the pump depends on, deliberately with a hold long enough to matter. There is also a frequency problem with walking that is easy to overlook. Most people who are told to walk more do it once a day, often in a single 20 or 30-minute stretch, and spend the other 15 or 16 waking hours sitting largely still. A single walk, however brisk, cannot compensate for that many hours of an inactive pump. The movements ahead are designed to be spread through the day in short bursts specifically because frequent, brief activation matters more for this particular system than one longer session ever could. Clinicians who work in vascular rehabilitation programs consistently structure their protocols this way, in short repeated sets rather than a single long session, for exactly this reason. That is exactly what the 5 movements ahead are built to do. If the peripheral artery disease number from earlier surprised you, put your age in the comments below. I am curious how many of you reading this have never actually been screened for it because the data suggests most people your age have not. The 5 signals and their resets. Rather than working through a generic exercise list, it is more useful to match each common symptom to the specific movement that addresses it, because the mechanism behind each symptom is slightly different. Signal 1. Cold feet at night, the ankle pump reset. If your feet go cold once you are off them for the evening, the most likely explanation is that blood has stalled in the smallest vessels around your ankles and lower leg, and there simply has not been enough contraction throughout the day to clear it. This is the movement clinicians reach for first, often before a patient is even cleared to stand after surgery, precisely because it requires no standing and no walking at all. Sit with both feet flat on the floor. Lift your toes toward your shins while keeping your heels planted, then reverse it, pressing your toes down and lifting your heels the way you would ease onto a gas pedal. That full cycle is 1 repetition. Do 20 to 30 of them, 2 or 3 times through the day. The 16 trial review mentioned earlier found this specific movement reduced measurable lower leg swelling in older adults with no additional walking required, which makes it one of the lowest effort, highest value resets on this entire list. The most common mistake is doing it too quickly. Fast, sloppy repetitions barely engage the muscle at all, while slow, deliberate ones create a full contraction and a full release each time, which is what actually moves the blood. If you can do this while the kettle boils or while you are seated at the dinner table, you are already ahead of most people who reserve movement for a single daily walk and nothing else. Signal 2. Heavy, aching legs by mid-afternoon, the seated leg lift. Heaviness that builds through the day usually points to the larger veins running through the thigh, which sit above where ankle pumps can reach. Straightening your leg and holding it activates the quadriceps and hip flexors, the same muscles responsible for standing from a chair, climbing stairs, and catching yourself if you stumble, and their contraction presses on those larger thigh veins to help drive blood upward. Sit tall with your back against the chair and both feet flat on the floor. Slowly straighten one leg out in front of you, hold for 2 seconds, then lower it with control rather than letting it drop. That is 1 repetition. Work through 10 to 15 per leg. Keep your back firmly against the chair throughout, since that single detail prevents you from using momentum instead of muscle, and the muscle contraction is where the actual benefit comes from. This is also the movement most directly tied to gait speed, since the muscles it trains are the ones that keep you walking at a stable pace as the years go on. Research tracking gait speed over time has found that a meaningful decline, even a fraction of a second slower over a short measured distance, is associated with a higher likelihood of hospitalization and loss of independence in the years that follow. Training the muscles that generate walking speed directly, rather than hoping walking itself will maintain them, is the more reliable path, particularly once natural age-related muscle loss has already begun. Signal 3. Feeling unsteady when you stand up, the supported calf raise. Unsteadiness on standing is rarely just a balance issue in isolation. It is often circulation and balance failing together, since both depend on the same muscles firing quickly and reliably. Guidance from the National Institute on Aging identifies maintaining lower body strength as one of the most effective things older adults can do to preserve the ability to rise from chairs and climb stairs without assistance, and the calf sits at the center of that. Stand behind a sturdy chair or counter with your hands resting lightly on it, feet about hip-width apart. Rise slowly onto the balls of your feet, pause for 2 to 3 seconds at the top with your eyes forward rather than down, then lower yourself over a full 3 seconds. Start with 10 repetitions and build toward 20 to 25 as it becomes easier. The slow tempo and the pause at the top are what force your calf and your balance system to fire together, which is precisely what your body needs to do the instant it catches a stumble. Falls among adults over 65 remain one of the leading causes of serious injury in that age group, and weak calf and ankle muscles are consistently identified as one of the modifiable contributors, meaning unlike age itself, this is a risk factor you can actually train against. The circulation benefit and the fall prevention benefit are not two separate outcomes here. They come from the exact same contraction. Signal 4, feeling unsafe on uneven ground, the single leg hold. This is the movement tied to the statistic that opened this video, and it deserves the closest attention. Standing on one leg forces your calf, ankle, hip, and core to contract continuously to keep you upright, which means the pump stays engaged the entire time rather than firing in the brief bursts that walking produces. That sustained engagement is exactly why the ability to hold this position for 10 seconds correlated so strongly with long-term outcomes in that 1,700-person study. Stand next to a counter or wall with one hand resting near it for safety. Shift your weight onto one leg and lift the other foot just an inch off the floor, standing tall with your eyes forward rather than down at your feet. Hold for 20 to 30 seconds, breathing normally, then switch sides. That is one set. Start with 2 sets per side, and as it becomes easier, rest your hand more lightly on the counter until you can eventually hover it just above the surface without touching. If you attempted the opening test and struggled to hold it, this movement is how you rebuild toward it deliberately rather than leaving it to chance. It is worth understanding why this single test carries so much predictive weight in the first place. Balance, circulation, and muscular strength are not separate systems that happen to decline together with age. They share the same underlying inputs, largely muscle mass and neuromuscular reaction speed, which means a failure in one is frequently an early marker of decline in the others before it becomes obvious anywhere else. That is likely why a 10-second stance test correlated with outcomes as significant as long-term survival. It was never really testing balance alone. It was testing the whole system at once. If that test was harder than you expected, that is exactly why this video exists, and it is worth subscribing now so the follow-up on rebuilding balance specifically actually reaches you when it is published. Signal 5, ankles ballooning by evening, the standing calf pump hold. This is the movement with the strongest direct evidence behind it, and it is essentially the calf raise from signal 3 with one change that matters more than it looks. The hold at the top. A randomized trial published in the Journal of Vascular Surgery tested a program built around calf raise training in people with genuinely compromised leg circulation. Over the course of the program, participants' pain-free walking distance improved by dozens of meters, and their total walking distance improved by nearly 100 meters, without medication and without any equipment. That improvement came specifically from training the pump to stay engaged under a sustained contraction, not from more walking. Stand behind a chair or counter for support, feet hip-width apart. Rise slowly onto the balls of your feet, lifting your heels as high as is comfortable, and hold that top position for 3 to 5 full seconds, breathing normally with your eyes forward. Lower yourself over 3 seconds. That is 1 repetition. Start with 8 to 10 repetitions and build gradually toward 15 to 20. The hold is not optional and it is not a small detail. It is the entire mechanism. That sustained squeeze is what fully clears blood that has been sitting stagnant around the ankles and drives it back up toward the heart, which is why this movement, more than any other on this list, is the one most consistently used in structured vascular rehabilitation programs. What makes the trial result notable is that it was achieved without medication, without a supervised clinical machine, and without any equipment beyond the participant's own body weight, which means the mechanism responsible for the improvement was the contraction itself rather than anything external to it. That is a meaningful distinction, because it means the same mechanism is available to essentially anyone able to stand and hold onto a counter, regardless of budget, mobility limitations, or access to a clinic. What actually changes when the pump restarts? It helps to know what a realistic timeline looks like, because expecting an overnight transformation sets people up to quit before the actual benefit arrives. In the Journal of Vascular Surgery trial referenced above, Measurable improvements in walking distance emerged over a structured multi-week program of consistent calf training, not a single session or even a single week. That timeline lines up with what shows up anecdotally as well. In the first several days, most people notice very little, which is normal, since you are retraining a mechanism that has been under firing for years. By roughly the second week, many people report that their feet feel warmer by the end of the day and that the ankle swelling they were used to seeing by dinner time is noticeably less pronounced. By the third or fourth week, the shift tends to move from circulation symptoms into confidence, specifically the sense of being steady when standing up rather than bracing for a wobble. None of this requires more than about 12 to 15 minutes a day spread across the 5 movements, and none of it requires new equipment beyond a sturdy chair or counter you likely already have in your kitchen. It is worth being direct about what this will not do. These movements will not reverse decades of arterial narrowing on their own, and they are not a substitute for medical evaluation if you already have a diagnosed vascular condition. What they do is address the muscular half of the circulation equation, the half that is almost entirely under your control regardless of age, and for a large number of people, that half is doing more damage than they realize simply because it has gone untrained. It also helps to understand why age is not the disqualifying factor many people assume it is. Skeletal muscle, including the calf, retains the ability to adapt to consistent load well into the 8th and 9th decades of life. Studies of resistance training in older adults have repeatedly shown measurable strength gains within a matter of weeks, often at a faster relative rate than younger adults see, simply because there is more room for improvement from a lower starting point. The muscle itself is not the limiting factor here. Consistency is. A pump that has been mostly idle for years does not need a dramatic intervention to start working again. It needs a small, repeated signal, delivered often enough that the tissue has a reason to adapt. The one signal this video is not for. Everything above is designed for the slow, everyday version of poor circulation, the kind that builds gradually and responds to gradual retraining. There is one category of signal that falls outside all of this, and it deserves to be said plainly. If you ever experience sudden, severe pain in one leg or a leg that turns pale, cold, and numb without explanation, or a sore on your foot or ankle that will not heal despite time and care, that is not something to work through with exercise. That combination of symptoms can indicate a seriously blocked artery, which is a medical emergency, and it needs to be evaluated quickly rather than managed at home. Everything in this video is built for chronic, gradual circulation issues, not for a sudden change like that one. To recap quickly, cold feet at night responds to the ankle pump reset, heavy afternoon legs respond to the seated leg lift, unsteadiness on standing responds to the supported calf raise, feeling unsafe on uneven ground responds to the single leg hold, and ankles ballooning by evening respond to the standing calf pump hold with its full 3 to 5 second hold at the top. None of these require a gym, special equipment, or more than a few minutes stacked across your day, and the research behind each one points to the same underlying conclusion. Your calf pump responds to training the same way any other muscle does at any age, often faster than people expect once they actually start. What matters most is that this is one of the few areas of aging where the research points toward genuine agency rather than passive acceptance. Circulation decline after 60 is common, but common is not the same as unavoidable, and the mechanism behind it, a muscle that simply needs regular, deliberate contraction, is about as fixable as physiology gets. 12 to 15 minutes, most days, spread across 5 movements you can do without ever leaving your kitchen or living room, is a small investment against outcomes as significant as independence, mobility, and according to that opening statistic, potentially years of life. Before you go, which of the 5 signals in this video did you recognize in yourself? Drop it in the comments, since that tells me exactly which follow-up to prioritize next. And if this was useful, subscribing means the next one actually reaches you. Take care of those legs. They are doing more work than most people ever give them credit for.